This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. Dr. Martin, how you doing?
I'm doing pretty good, Amy. How are you doing today?
I'm good. Well, you got the low voice going on today.
Very low. I got my surgical cap on. I'm feeling very manly.
Feeling low.
Yeah.
Well, today we have a really interesting topic, and if you're interested in seeing the few slides that go along with it, you can find those on YouTube at Jason Martin MD. One quick note, if you are a loyal listener of Beauty and the Surgeon and you want to help us out a little bit, we actually are desperately trying to get up to 1,000 followers on YouTube, because when we do, we can actually have our merchandise
We
up.
can sell some swag.
Right. So until we have 1,000 followers, though, we're in YouTube limbo. So if you'd like to give us a follow, we would highly appreciate it. So you can find that at Jason Martin MD on YouTube. We're also on Instagram at Beauty and the Surgeon podcast. And without further ado, we're going to get into our topic today.
All right, so what are we talking about today?
So today we're talking about breast enhancement or augmentation, but how that could take place without implants, right? I feel like this is like the unicorn of plastic surgery, suck fat out of my anywhere, fill in the blank, and put it in my breasts, and life will be magical, and I will run off into a field of rainbows.
Right.
Yes.
And it would be awesome if that was the way it was.
It would be awesome.
Yeah, but it's really not. I mean, I feel like lately we've been bursting a lot of bubbles, but it's not the same as breast augmentation with an implant, no matter what someone tells you, because the problem is you really can't transfer enough fat and have that fat survive to equal what an implant does.
Right. And also, as you and I, when we were kind of talking about this episode, discussed, in most cases, women who seek breast augmentation, despite what they say about wanting to look natural, they have a very specific look in mind, and that is an extremely full upper pole.
And what's the upper pole?
The top part of the breast,
okay.
So above the nipple and areola.
Because you're throwing out medical terms. We've switched places, because you used to be the one who would correct me.
Right.
And now I care about the public and the listeners, and I'm correcting you.
That's right.
Okay, that's good.
So that's, in your mind, when you picture an augmented breast and you want a breast augmentation, no matter how natural you tell your surgeon you want to look, what you really want is a very full, firmer breast. And that is not what you're going to get with fat transfer.
Yeah.
So
now, I don't know, like firmer may be the wrong word, because I think universally most people don't want it to feel firm, but they want it to, what's a different word than firmer? I know what you're saying.
Well, I'm saying firmer. I'm not saying firm or hard. I'm saying they want a more toned breast. They want a firmer, more toned, more youthful breast.
Right.
They don't want it to feel loose and saggy anymore.
Right.
So, this is the question. Is fat the fix for a flat chest? That's what we're talking about. Is fat the fix for a flat chest?
I mean, that's really good. Did you write that?
Yes, I did.
Oh.
Yes.
I wish I could say it was. I do a lot of fat transfer with breast reconstruction. Okay. It's not for cosmetic reasons. Now, if you want a little bit of an improvement, you could use fat and it would make a difference. You can go online. I did. And most of the stuff is in foreign countries that really advertise this procedure. There's a couple people, like one guy in Miami who's really good, and a couple people in the United States, but it's just really not going to be enough to make enough of a difference for a majority of people.
Yeah. So I have a good slide here that just kind of talks about the pros and cons of fat transfer to the breast. So let's talk about these first, and then we'll get into more of the specifics about what fat transfer to the breast really looks like and is. And let's start with the pros. Yep. We're about pros. No implant. We've talked before about some of the issues that are revolving around implants.
We're on episode 1050 now. We've had so many episodes, but if you go back and you listen to, it's called problems with breast implants or
breast implant complications.
That's a really good episode. Actually, has a pretty high viewing rate or numbers, and that shows you there really is problems with breast implants, and those implants can cause not just problems I mean, even rare problems like lymphoma and things like that with textured breast implants. So I think if you can avoid a breast implant and have the same kind of result, I personally would choose that, and I would recommend that to my patients. So you do avoid an implant. That's positive.
Right. So no implant, small incisions, as we'll talk about when we talk about the specifics of the procedure. We've talked about fat transfer in other areas a lot of times in the past, and that's always, small incisions. It's little poke marks almost.
Yeah. And those heal, you can't even see them.
Yep. Little incisions. Low complication rate. So fat transfer in general, there are rarely complications from it. That's a good thing. Breasts are going to look and feel natural, which is, even though, like I said, that's what most women say they want. Do you really?
They say they want. Do you really want it?
Is that what you really want?
Really?
You really want to double down on what you got?
Are you sure?
Right. And patients are doctors, and doctors are generally satisfied with results. And we'll talk about when we talk about the type of fat transfer, fat grafting that you do to the breast, why that's the case. Like that there is a really high satisfaction rate in the type of fat transfer that we do.
Yep.
So let's talk about some of the cons. And it's interesting because back in the early 90s when the ASPS came out and said that like fat transfer to the breast was like not a good idea because they thought there were all these weird things that could happen.
Well, because the main thing, we've talked about this before too, is that the fat, whenever you transfer fat, some of it's not going to make it. And some of that fat can form little microcalcifications, and that can actually affect mammograms.
It's on here. It's on my list.
Oh,
You're jumping ahead.
I'm sorry.
But they've since come back and said that that's not the case. Like that there's really no cause for extra concern because there is low complication rates. We talked about the pros. However, there's also no standardized technique. Like this is kind of the wild, wild west with fat transfer.
And then you get into stem cells and cell-assisted lipotransfer, and then the wheels fall off.
Exactly. So no standard technique, which means that there's really not a lot of like collaboration within the field of plastic surgery. Like this is how we do it, and this is the outcome, and this is how you can repeat this outcome. So there is that. Limited increase in breast size. At the very most, even in probably best case scenario, you could maybe increase the breast size by a cup size.
Oh.
But that would be hard. But that would be the most. Yeah. Yep. A breast lift may still be needed because, again, you're not actually doing anything to lift the breast.
What?
Right?
Like, I thought when you augment the breast, it lifts the breast, Amy.
Right? Lift some Perky or Barbie from the 90s.
It does not. We talked about that on the breast augmentation episode. And then we talked about that again on the mastopexy or breast lift episode. So any augmentation of the breast technically is probably not going to really lift your nipple and areola. If it's pointing toward the floor, it's still going to be kind of pointing toward the floor after you augment it.
Yeah, and it's certainly not going to lift your inframammary fold.
Right.
So that is not going to change. Fat may be reabsorbed. So we've talked about that a lot.
So we always get like the quintessential person. They come in and they're like, I don't want an implant, and I want to take my own fat and put it in my breast. Almost always they're like, body fat percentage of 15%. They have a super high metabolism. Like they eat whatever they want and they burn it all up. What do you think is going to happen to the fat you put in their breast?
Right.
Your body's going to metabolize it. And then, they go see people. And most people, I think, are pretty straightforward and honest. But some people say, oh, yeah, my technique will make that fat survive. No, it won't. Your body will absorb it just like it does all the other fat in your body.
Right. And you have to remember that even though the doctor knows why he's putting this fat there, and why this fat is going there, on the cellular level inside your body, all it knows is something new is there.
Yeah, what is that?
So it has to decide. Do we give this blood supply and keep it, or do we just let it kind of just go away?
Right.
Do we starve it of blood and have it just dissolve? So for physiological reasons, not all the fat is going to be a take, no matter what technique is used. And then, like you mentioned, calcifications may interfere with breast cancer imaging. And that's true.
It would be interesting if you could actually put words to the fat being transferred from someone's flanks to their breast. What do you think the fat would think about that? Do you like your home better here?
Right.
Do you like it better in the breast?
Probably liked it better in the flanks because it had native blood supply.
Exactly.
You throw it into an area where there's no food, you're like throwing all these starving cells in, like, oh my gosh, are we going to survive? It's like being the new kid in a freshman year.
There is studies that show that fat taken from certain areas survives better in the breast. For example, the abdomen as a donor site is better than the lower extremities.
And that's because of the hormonal signaling in those areas. We've talked a lot before on episodes about fat functioning as an organ in the body and not
that episode
as individual cells.
Was this talk about fat or something like that? Yeah, that was a really good episode. And really talked about the science behind it and the fact that we really don't know totally about fat.
Yeah. But in general, I mean, if you think of areas where your body preferentially stores fat, that fat will probably be a better take in an area where you want to put it because it's probably getting a stronger hormonal function or hormonal signaling there.
Yeah.
Hypothetically. Yeah. And the number one con of fat transfer to the breast is there's not enough spare fat to transfer. Like as much as people can pinch at skin and think that there is tons of fat there, in most of these cases, like you can pinch a lot and there's not really much fat there to take.
Which is evidenced by the fact, because we do body tight or liposuction body contouring every week, and they're like, I'm going to be like down like 20 pounds when you remove fat from the flanks or the abdomen. It's like a half a pound.
If that. Fat is not.
It's very heavy. Yeah. When you lose weight, when you lose 10 pounds, you lose fat from all over your body. And by the way, FYI, you lose muscle.
And you lose water.
And water, yeah.
Yeah, you're holding less water because your fat cells are holding on to less water. Like your weight loss is a very complex thing. Fat extraction is pretty simple.
Yep.
So,
well, was that like a low blow to me?
No, I just said simple, meaning it's the process is we literally just suck it
hard.
Out. Yes.
That what we're doing, like to understand that is simple.
It's simple.
Okay.
Yeah.
Just to clarify.
Just to clarify, it's very technically challenging. All right. So let's talk a little bit about what primarily you do when you're doing fat grafting to the breast. You're mostly doing it to or to make some adjustments to an already reconstructed breast.
Yeah. I actually, if you look on Jason Martin, MD, the slides probably could be a little bit granular, but I actually put this on there for a reason. This was actually taken from a Taiwanese website. And I only put this up here because look where they're injecting the fat, in the muscle and underneath the muscle.
Right.
And where our last episode when we talked about BBL, what was the big problem with that?
Injecting fat into the muscle itself.
Which leads to fat emboli to the lungs, which is a life-threatening, serious condition. So I bet you, the pectoralis major muscle, which is the chest muscle, doesn't have like the big blood vessels as you see on the gluteal muscles, but still you got the thoracoacromial blood vessels, which are up at the top. Theoretically speaking, you could get into some big blood vessels there. I would not inject this into the muscle, not in OT. And I definitely wouldn't go underneath the muscle because that's your chest wall and you could get into your lungs.
Oh my goodness, can you imagine if you injected a fat bolus right into somebody's lung?
You could use an ultrasound maybe. And I didn't see any studies on that, but this was very odd.
So you can see yourself doing it. Oh, like that's the moment I punctured a lung.
Oh, there we go, right to the chest wall.
There we go.
This episode has gone off the rails. Okay, but the reason why you want to inject the fat graft into the muscle, or you desire to, is the muscle has much more blood supply than soft tissue. And why is that? Because muscle needs more oxygen. Oxygen comes from blood. Okay, and the circulation, and so muscles just have more blood supply, period. When you inject, so people think, so they have this kind of like, why is it, well, I guess it's not, it doesn't really come to people normally, but why do they always think the fat grafts, it's like magic?
Right.
Like you just take fat from one part of your body and just throw it in another.
Well,
and your body's like, what's up? Hey, this is great. It doesn't work that way because it needs blood supply to live like everything else. And it has to get it by something called imbibition, which is like literally little blood particles that happen to be floating around. They have to feed this fat graft till it makes its own blood supply.
Yep. And that's taking into account that not every fat cell that you inject is viable. Like it could be damaged during the extraction process and break down its little cell walls and it's no longer able to live at all.
And if you get the bigger fat globules, the inside definitely necroses and only the outside lives. And it gets pretty complicated. So the reason why that you cannot, in OT, augment a breast enough for most people's liking is that you can't, there's no technical way to inject that volume of fat and make it live. So the fat needs to be injected in a really layered micro fashion, very small amounts, so you can ensure that blood supply would get to that in a very complicated manner. So it'll survive and then make its own blood supply and grow. And you just can't, there's no technical way to do that. People are trying to like cut the corner and put stem cells in there, but that again, that's great and all if you have stem cells, which can grow into things, but it doesn't mean you're gonna have blood supply to it either.
Right, and it still needs the fat cell to actually grow. I think this is an interesting slide, and one of the things I actually did not bring up in my slide where I talk at the end about other things, and I meant to, but I forgot to, was this was actually big for a while. There was even a woman who did it like on a national news station, did this hyaluronic acid water injection into the breast, like for a special event. She thought her boyfriend was going to propose. So you literally go in, you'd go into a doctor's office and they would inject.
Oh, this was huge in New York.
It was in New York where she did it. And this was on like Good Morning America. Had the saline hyaluronic acid.
It lasts for like 3 days.
Well, or for a couple of weeks. Like she had some fullness.
It starts to dissipate in 3 days.
Oh yeah, it starts to dissipate right away. Like you see some difference for like, they said up to 2 weeks.
So basically it's like for going to Las Vegas or someplace you would do for 3 days.
Yeah, but it's like when we temess somebody. It's the same idea. You really bloat somebody with fluid and they add the hyaluronic acid to try and draw in more water to it, to give that a look. But it goes away.
Yeah.
So that, I mean, they've tried that too, and that doesn't work. You can't blow the breast up like a water balloon and expect it to last.
Doesn't work.
Doesn't work. So this might be a good point to take a quick break and hear a word from our sponsor, and then we'll be back to talk about some more details about fat transfer.
Sounds good.
Dr. Martin, I'm super excited to talk about our sponsor for this podcast, Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and that's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically you're saying we're very choosy.
We're very choosy when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like, you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly, and the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it, literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like, is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah. And Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30,
yep,
so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where 2 of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs, or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah. So as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC, so TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right. Well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
All right, so we're back talking about fat transfer and other types of non-implant related augmentation for the breasts. And let's talk about stem cells. I saved this till after the break because this is kind of a huge topic and I knew we'd kind of get into it, but there's actually a technique going around that's called a stem cell breast augmentation. Like, this is a real thing. Like, if you Google search stem cell breast augmentation.
Or cell-assisted lipotransfer to the breast.
Well, that's
CAL. But you're using adipose stem cells.
Right. And the theory is, and this is my point, like stem cells alone cannot be injected into the breast and be expected to increase the breast size. So if you extract just stem cells, inject just those, really no change will happen, because you need to mix those stem cells with fat so that those stem cells have fat also to kind of encourage that fat growth. So it's kind of a misnomer to think that there is such a thing as just stem cells. Like you can't use these like tissue or lab grown stem cells or some of the, oh my gosh, what's the stem cell particles? It starts with an E.
Oh yeah.
Not endokines.
No, I know what you're talking about. Why did you have to say that?
It's something with an E.
Yeah, that's right.
But there are
Put
these,
it in the show notes.
Yeah, there are these bits and pieces of stem cells that are being used now, that are extracted from whatever source they come from.
Could be cord blood.
Yep.
Could be fat. There's many different sources now of stem cells.
And they're sometimes mixed with your own PRP or your own blood.
Yeah,
So there's
PRP is the plasma. It's just your blood that's been spun.
Yeah.
And you take the top layer that kind of comes off of that.
And those things alone, those things alone, like, so even if you took, these, whatever the stem cell particles are that start with an E, and mix them with your own PRP, like if you just inject that into the breast, you're not going to see tissue growth from just that, at least not that they've been able to prove in studies. But there may be some benefit of mixing these stem cells and with your own fat when you transfer,
right?
To assist the fat to grow. But that still is really,
and then maybe some of those stem cells would grow into fat cells,
right? That they would become a fat cell, by association. Like,
it's like I looked into this, and there's really not a lot of good studies, and a lot of it is being done in foreign countries because right now stem cells are fairly highly regulated in the United States, and probably for good reason.
Well, even fat grafting, the standard way that we do it, which we can talk more about, is, somewhat under the eye of the FDA and how much you can manipulate that fat before you re-inject it.
Right. So that's the main thing. If you take human tissue out and change it and put it back in, that's a no-no with the FDA. That's really important to understand. So if you took...
Doesn't mean that there aren't people doing that.
Well, please. And there's people go to Mexico all the time for that. So if you take a fat graft out and you add your own PRP, you're technically not changing the fat graft. And the PRP is just a component of your blood. So that mixed together, I think, is fine. If I'm wrong on this, don't write us an email and tell me I'm wrong. But beyond that, if you add things that change around that fat or even augment the fat, it's my understanding that that's a no-no, and you can't do that right now.
Yeah, and even this is a lot of the reason why we used a closed fat grafting system, which we've talked about before, which is pure graft.
Yeah.
So pure graft is a closed system, meaning the fat never really leaves this kind of system. It's sucked out.
Closed loop.
Yeah, and then it's kind of re-injected without even being transferred manually.
It's like what you would see on the movies with the cardiac bypass. They take the blood out and put it right back in.
It's kind of
after they clean it.
Yeah. So that really is a way to really make sure that you're meeting that standard of not augmenting the fat at all, but you're also getting really pure, really good harvestable fat, really good fat, because you're treating it really gently.
Yeah.
It's, closed loop system to prevent cross-contamination or infection. So it's a really great system to use, and that's what you use all the time.
Yeah, pure graft is great. Yeah. And basically what it does is it has a diaphragm and it has little holes in it, and the fat globules can go through the holes are the perfect size for it to survive once you re-inject it. And the rest just gets kind of washed away.
Filtered out into the suction canister.
So you just have the perfect size fat globules, wash of all the blood and inflammatory factors. And you put those in syringes and re-inject it. So pretty good.
Perfect timing to talk about this life cycle or the cycle of fat.
Ooh, yeah. So this is such a funny diagram if you look on Jason Martin, MD. I like this just because it shows you different types of stem cells, mesenchymal, adipose, ectodermal, and it shows you and this is all kind of related to, if you go back to your biology in high school about the egg, becoming pluripotent, and then it starts growing and all these cells differentiate into different types of cells. So you start with the singular cell that all of a sudden grows into all these other cells, and those are basically stem cells, and that's what it does.
Yeah, and stem cells create everything in the body, not just fat. They create muscle and neurons, and that's why stem cell therapy, and you were actually talking to a patient about this today, the advancements or the research that's being done on using stem cells to treat neuromuscular disorders and for regeneration of tissue.
And Parkinson's and Alzheimer's. Yeah. I think that's the future, but the problem is we're so far from that.
We are.
Yeah.
And again, there's no standardized treatment.
No.
So anybody who does this is just doing what they think is going to work.
I know. And that's what's frustrating, because you see these websites and, people like proclaiming they're doing all this stuff and they really have no data behind it. With that said, will there be a day that you can inject stem cells into your breast and all of a sudden your breasts grow like 3 cup sizes? Possibly. Is that going to happen in the next 10 years? Absolutely 100% not. And please do not replay this when Elon Musk comes out with some breast enhancement technology.
Hopefully, if stem cells are able to regrow something, they would use them to regrow neurons.
Yeah, of course.
Before they use them
They're
to
not going to do it for
breast,
cosmetic reasons, but that's where it's going to come
heart
from.
tissue, organs.
And they are doing that now.
Yes.
They are really looking at stem cells and nerve grafts for paralysis, for neurodegenerative diseases, especially for Parkinson's and Alzheimer's. And the idea would be that you would put in nerve grafts just like a fat graft, and then a stem cell with it, inject it into the area, and then all of a sudden it would just start living and start growing and stuff like that.
Yeah.
The problem is that we don't really know how to control stem cells. Stem cells, there's like a copious amount of stem cells. We don't know the factors that cause them to change or how they do this or that, and that's going to take a long time for us to understand. And probably it won't just be stem cells. I mean, it never works out. It's not that easy.
Right, it's not. Our bodies are not that simple.
No, you just can't take a stem cell from your bone or your inside of your bone and think that it's all of a sudden going to differentiate to whatever you want.
Or that it's going to grow an arm.
Yeah, it doesn't work that way. But they are getting there. Things are it's going to be amazing in the next 10 years to 15 years to see how far we can get.
Yeah. And there, it's interesting when you talk about, I'm kind of reaching slightly, mostly because you treat patients with breast cancer, and there's a new type of treatment that they give to women with certain types of breast tumors that starves them of blood supply. So in that case, are they a good candidate for fat transfer following their reconstruction?
Yeah,
they're on that medication.
That's a really good question, and then we don't have an answer. And there's so many issues like that when you treat cancer patients because they're on immunomodulators. Right. There's been no studies to show what these like how these ones that like target the immune system and really boost it up so it can fight cancer. I mean, having fat grow is kind of the same idea as cancer growing. I don't want to compare it, but it's the same idea. So that growth of a cell, will this immunomodulator affect that or not? Most of these patients have had radiation. How does that work with it? And so there's so many different factors that make it very complicated for reconstruction.
Yeah, because part of the process of fat transfer is you need that initial inflammation to bring in inflammatory factors, to bring in blood, to bring in things to eat up the fat cells that aren't going to make it, but also to bring nutrients and blood supply to the ones that are. So if you're highly immune, either boosted or suppressed, one or the other, that's absolutely going to affect the outcome.
I don't know, immunosuppressed. I don't know, we don't have studies that show what fat grafts do in the immunosuppressed people. I mean, that I know of, that may be out there.
Yeah. But something that we really didn't talk about, which is the really awesome side about fat transfer to the breast, which is how it can be used after breast reconstruction.
Yeah.
We have a great episode about breast reconstruction specifically. And in there, we touch briefly on fat transfer, but you think about having a mastectomy. It takes off all of your breast tissue, a lot of times some of the muscle underneath. We do reconstruction, Dr. Martin puts an implant in, but that implant is basically underneath the skin, a very thin layer of skin with minimal subcutaneous fat. It's scraped down. So a lot of times, that implant is extremely visible through, you can perceive the implant through the skin, meaning you see the rippling, you see the shape, and adding in a moderate, a little bit of fat around it really helps cushion that effect. Helps it look a lot more natural, helps it make it not show through clothes. You can, hide those kind of deformities that are hard to hide through just a little layer of skin.
I actually think fat transfer, so this is funny, we're talking about it cosmetically speaking, but for breast reconstruction is one of the best things I do. So it's funny, it's different sides of a coin. You're still injecting it, but that's the difference is for breast reconstruction, at the most you would put 100 cc's in.
Which is still kind of a lot.
That's a lot, but it's not in comparison to what you need to put into an average person to make them have a difference, at least in the cup size, which is going to most likely be 300 cc's. You're only a third of the way there for cosmetic reasons, but for reconstruction, 100 cc's can be transformative.
Yeah, because it just fixes those little areas, really kind of feathers things out and provides a little cushion.
And it's cool because it's like fillers. You're sculpting the area and taking these deformities out. And, in most cases, the fat does well. We've said this many times before when we talk about fat grafting, 60%, just put that number in your head, is about what makes it if you do it correctly and use something like a pure graft system, keep it closed loop, something that's pure fat that's not damaged, healthy person that's non-smoking, that's non-diabetic, 60% of the fat will make it. That's best case scenario.
Yeah. But it really, in that instance, I mean, it can be really transformative for their end result. Like,
Yeah.
really. And same thing like around if you're doing nipple reconstruction, like adding some fat into that area.
Oh, yeah.
You know, the really awesome things we know with fat for the breast.
And by the way, fat grafting in the face, which we do a lot of, is amazing also.
Yep.
So fat grafting in smaller amounts, think of like your hands or areas that are small, really do work well. It's the larger areas that we've had either problems with the fat making it, or like in the case of BBL, which we did
Just
last
getting enough of
episode, yeah, is that we've had safety issues. So, you know, we really haven't cracked that nut yet in terms of how do you do large volume fat transfer, make sure it survives, and make sure the patient's safe.
Yeah. And make sure it's that you could actually replicate that result. Well, let's talk a little bit about magic creams and other promises.
Oh my God, I didn't even know you were doing this.
Yeah. So I
Are
think
we going to talk about brasiers too? Like
like push-up bra? No, but I think I mean, every young girl probably saw or has heard at some point, like read ads in a magazine back in the day, or had, someone's older sister.
I know I did.
Tell them about this like magic cream, or like you rub mayonnaise on your breast and it will make them grow.
I'd rub mayonnaise on my breast.
Right? To make them grow?
Yeah.
Yeah. Like there are all these like things that you hear as a woman, so topical creams, like this will make your bust grow. Like all these things will do magical things for you. Laser treatments are often touted for helping like improve the texture and tone, which it can do. Like you can improve the texture and tone of your breast skin like you can the skin anywhere else on your body, but it's certainly not gonna make them any bigger. Threading, I think we talked about threading in our episode about facelift for the face. Mm-hmm. There are people who do this on the breasts.
Oh, of course there are. Because you know why? Because they charge what? Per thread.
Right.
$1,000.
And they put these deep threads
in. They put like 5 of them in. Oh. So you just paid $5,000 for a thread that goes away in 6 months.
Yep, at best, and can extrude through the skin and like have tons of issues.
Yeah, I mean, I'm sure it's fine. I'm sure the people that do it well are doing okay, but like I just don't get the financial investment.
Yeah, just save your money and get a breast lift.
Yeah.
Thermage is a radio frequency. It's been around, probably one of the longest well-used treatments that's been around for a long time. It's very painful. It uses radio frequency externally to kind of plump the skin a little bit, plump it and tone, to give you a slight lift. And then my favorite to help strengthen and tone the breast is bench press. And yes, women, you can bench press. So on the back of my shirt, it's going to be bench press ladies. On the front, it's going to be squat ladies. So so you can't, but by building the pecs, you are going to help improve the appearance of your overall chest.
Yeah.
Is it going to replace a breast lift? Like, absolutely not. But it can certainly make your chest look better.
Yeah.
Without making you look bulky. You will not look bulky. Like you can bench press as much as you can, and your chest is not going to be bulging out of your shirt.
I mean, it depends on what you're taking.
If you're taking some drugs with it, then you might. But, really.
We've seen that.
Yes.
Yeah.
I mean, all of these other things, as much as we'd love to say that, we have a magic treatment that if you rub this lotion on, you're going to increase your breast size.
That's how you get hits on YouTube. We have a magic treatment to make your breast bigger.
This cream. Mm-hmm.
Some special lotion. I can't believe you didn't come up with something that was holistic and some root.
No,
that's like so your style. It's like acacia berry rubbed on your breast. No,
chaste berry is not gonna make your breast grow. Like, no, will not. So I think really what this whole episode comes down to is fat the fix for a flat chest?
No.
Not right now.
Not right now, but it may be in the future. So we love fat grafting. I really use it a lot in reconstruction, and not just for the breast and the face, wherever people have injuries, scars. It works really well. Mm-hmm. We would prefer to use your own fat, right? Because it has a lot of benefits, and as Amy said, ultimately it has minimal downside. Mm-hmm. I have over-injected fat before, and some of that fat didn't make it, and so it had an inflammatory stage where it stayed red and was kind of, hurt a little bit, but then it was fine after that. So there is, if you get too aggressive, and that happens, right? You have people with really bad deformities, and you're trying to push it because you want to give them the best result you can. And it's impossible to know exactly how far you can push it with fat grafting, Well,
because everybody responds differently.
Yeah, exactly.
Yes.
And right, and this lady had radiation, and with previous radiation, all bets are off. But she did fine after that, but there was a period where she had some discomfort. Other than that, I mean, maybe infection, that's a possible complication.
Yep, of any injection, not just fat, filler, Botox. Anytime you're breaking the skin, you could get an infection.
I wish we had like a secret sauce here.
I know. But if you're out there and you think like, this is magic, I'm going to have the fat sucked out of my body and injected in my breast, it's going to be amazing, it's going to be look like a breast augmentation.
Right. It's not going to be that way.
Probably not reality.
Yeah, you can have a little bit of a change. You get
Yep.
fat taken from some other. That's great.
Yeah, there is. Oh
Enjoy
my
it.
gosh, there's a company that actually.
So there was. I'm sorry to interrupt, but I think you're going there. But like, there was that guy in Miami. It was Miami, right? Was it Miami? That he has that suction device that he puts on the breast. You remember seeing
Oh
that?
no, that's kind of like it's like a penis enlargement thing, but it's for the breast.
Yeah.
It
It's
does. It like sucks the breast in and like
And you're-
engorges it.
Right. And
yeah.
he had people wearing it at work
Yeah.
with like
It's like the
suction,
duck lip thing too.
like
Yeah.
over the shoulder battery powered suction devices. And what it does is like really stimulates that skin and soft tissue to grow. And then he injects the fat right after
Constantly
that.
stretching it.
Yeah.
Yeah.
I just can't imagine a patient would tolerate that for weeks.
People will tolerate just about anything
Yeah.
to try and get bigger breasts without an implant.
Yeah. I get it. And so,
Mm-hmm.
you know, he has presented data at our national conferences, and I'm sorry I forget his name, but that's been pretty interesting. But even then, I wasn't super impressed with the before and afters. Honestly, like very good surgeon, very smart, you know, followed all the rules, did, you know, IRB and everything. You know, he did it the right way, and it just still wasn't. And that's why I'm not doing it.
Yeah.
You know, if I'm going to torture someone for 4 weeks, I want, you know, you better damn well have a good result.
Well, we to be fair, we have tried some out there things. Remember that nipple disc to put on after reconstruction? That person had like sterilized twice a day in boiling water, and it was like this. You would put it on after you did a nipple
Yeah,
reconstruction.
but that was kind of cool, even though it didn't work.
Right, but I mean, it did kind of torture a patient
Yeah.
for 6 weeks.
But yeah, we told him that
We
beforehand.
did.
Yeah.
She knew she was a.
Yeah.
I mean, it worked real well at first, but I mean, as with a lot of these things, once
We
the
could
fat-
rebrand that
yeah.
and sell it to like, you know.
It had that little, remember it was like that little, it was like a pencil eraser that you'd stick underneath and then you'd wrap the tissue around it to kind of make the nipple.
Yeah.
It-
Yeah, we had the implant in the nipple for
That's what
reconstruction.
I
too.
mean. It
That's
was
what
like
you're
the
talking
little nubbin. It was like
Yeah.
a little pencil eraser. Yeah, that you'd like stick in and then you had to wear this nipple guard that was this thick
about.
silicone
That's our next
plastic.
episode.
Yeah.
Stories from Amy and Jason
Strange.
regarding strange stuff we've done in the past.
So we've done some strange things. But if you are interested in learning more about breast augmentation or breast enhancement or fat transfer of any kind, we do have some great past episodes about fat transfer, about breast aug, about implant selection, some really, really good ones to answer your questions, all things about the breast. We do also love to hear your questions. Are you okay if I do the wrap up?
Oh, please.
Okay. I didn't want to wrap up too soon, you know, like just in case there was something else.
I mean, what else are we going to say?
I don't know.
Yeah.
Magic, unicorns, magic cream. I've got the magic cream.
Yeah. I mean, I just want to get done with this episode so I can go rub mayonnaise all over my breast.
Okay, eat some carrots. But we do love your comments. So if you do have any questions, please leave a comment for us on any of our platforms or wherever you listen to our podcast. You can find us on YouTube at Jason Martin MD, and wherever podcasts are found, we're found there too.
Yeah.
We'd love it if you
I think
leave
we're
us
even on iHeart now. I think we got to talk to Sarah about that.
Are we on iHeart? Yeah.
Yeah.
We were still trying to get on Pandora though. Pandora's our holdout. You have to be really popular to get on Pandora.
I mean, shout out to Pandora, but like, I mean, come on.
They're very exclusive.
Oh, please.
But we also do have a fun, exciting thing. We have a voicemail now. So if you'd like to leave us a voicemail message, we might play it on the episode. And that number is.
We will play it on the episode. Leave us a voicemail. We'll play it on the episode.
Well, if it's okay with you.
Yeah, if it doesn't have cuss words.
Well, we can block stuff out. The phone number is, get your pencils ready, 303-630-9038. And that will be in the show notes. So please leave a like, comment, rating, review, share us with your friends, leave us a voicemail. What else can we ask for?
Well, I mean, the voicemails are going to be great because we're going to have an episode where we just do all voicemails and then answer the questions, which I
will be a lot
love.
of fun. Yeah. So
So
thanks,
that's
everyone.
that's a Nils idea too, by the way. Good job, Nils.
Thanks so much for listening. We really appreciate you being here. Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.